Welcome back to the Arise interview. I'm Charles Aniagolu. Now, as the coronavirus pandemic accelerates, global healthcare systems have become overwhelmed with potentially infectious patients seeking testing and care. Preventing the spread of infection to and from health care workers and patients relies on effective use of personal protective equipment, gloves, face masks, air purifying respirators, goggles, face shields, ventilators and gowns. A critical shortage of all of these has already developed in areas of high demand and is projected to develop in areas of low demand and low infection, such as Nigeria. Personal protective equipment, formerly ubiquitous and disposable in the hospital environment, is now a scarce and precious commodity at a time when it is needed most to care for highly infectious patients. An increase in supply in response to this new demand will require a large increase in manufacturing, a process that will take time, which many healthcare systems do not have, given the rapid increase in COVID-19 patients. So, how prepared is Nigeria for this? Well, for more on this, I'm joined now in the studio by Aisha Abubakar Achonu, owner of the Fashion Spaces Garment Factory, or SGF, a company that manufactures surgical masks, gowns and other medical equipment. Thank you very much indeed for coming in.
Thank you for having me.
What's the state of play as far as the availability of personal protection equipment is concerned in Nigeria now? At least that to the extent that you're aware of it.
Okay. So we've had a couple of demands, but distribution has also been a problem. We've had people asking us if we can produce for them. Before the lockdown, we did some production, but that was a social campaign. We distributed some of them for free. But now that there is a lockdown, distribution is going to be a problem for us. But I think there is a high demand.
Well, I thought you guys were exempt from it. I mean, there are people who manufacture medical equipment, people who work in hospitals, journalists and all that sort of thing. I mean, that's why we're able to, people who work for us move around. And
for garment manufacturers, we haven't received an exemption letter. We actually wrote for it. The association wrote a letter day before yesterday, but we haven't received any response
But
yet.
you're making medical equipment, though?
Yes, personal protective
Yes, absolutely.
gear. Yes.
Which is what you really, which is one of the most critical shortages.
At the moment,
right.
Yes.
And that is why that should be built up quite a lot before it gets worse in Nigeria.
Yes, exactly.
Tell us about your company and what sort of medical protective equipment you actually make.
Okay. We are a mid-capacity garment factory. So we produce personal protective gear like coveralls, overalls, and then surgical masks. We do not produce the N95, but we produce the cloth mask, and then we also produce the surgical mask because we have supply for the fabrics that we use in doing that. The textile, polypropylene, is used to make the surgical mask, and then for the cotton mask, we have that fabric available. Right.
So equipment that was once easily available and disposable in Nigeria is now becoming a precious commodity. I imagine that's the case.
Very much.
What sort of, you said you've got a couple of orders.
Yes.
When you say a couple literally means two.
Yes. So we have some NGOs that have reached out to us. But like I said before, the primary issue is distribution, logistics, and to make sure that our staff are safe, because we have to put safety measures in place. We have a quarters that is within the factory premises. We have to put safety measures in place to make sure that people don't go out, even to get food. Our staff need to be tested. We have to get tested. We have to all stay isolated if we're going to be producing these items, and also distributing in a very, very safe manner.
Right, but I would have thought that you would be swamped with orders. Because internationally that's what's happening. Obviously they've got thousands of,
but
I would have thought that because beyond the hospitals and the sort of government orders, I mean, ordinary people are buying face masks, and I expect that that the governments and medical institutions are also stocking up on things like that as it continues to, the numbers of infected people continues to grow every day.
Yes, this is a very good question, because it's quite surprising. And the Nigerian Textile and Garment Manufacturers Association, we've been deliberating for the past week. We've been wondering why we haven't been reached out to, considering that CBN earlier in the year,
that's the Central Bank of Nigeria.
Central Bank of Nigeria had signed an MOU between us and the paramilitary for our association to produce personal protective gears for paramilitary and other organizations that need items as such. So we are surprised that the NCDC hasn't reached out to us.
Well, have you reached out to them?
Yes, we have written a letter. And we are aware that importation is being done, and we don't understand why. Because I have a mid-capacity factory, I can produce 4,000 masks a day. Cloth mask, and then the surgical mask as well. We also have textile companies that produce the polypropylene used in producing the surgical mask.
But they're importing them.
The fabrics?
No, the government is importing them.
Yes, the government is importing them.
But I mean, before the outbreak of coronavirus, were you supplying the government and people like that, hospitals and so on? I mean, who were your main clients? Well,
most of them are imported, really. We had very few people that were ordering from us, very, very few. If I tell you the number, you might be quite surprised.
Yeah, but what I'm saying is that, I mean, the whole point of the thrust of the Buhari government has always been to indigenize as much as possible the manufacture of things. And they were particularly supportive of manufacturers.
Yes.
But what you're saying is that they haven't been buying your equipment, basically.
No, they haven't been buying.
Do you know why?
Well, that's not in my place to answer.
Well, I mean, I would think that you'd want to know why, somewhere. If you came in here and say you don't want to sit next to me, I'd want to know why. I mean...
Well, I'm not sure, because in terms of technical know-how, we do have that. We have the machines.
Are they actually aware of your products?
Yes, to an extent they are, because we've written several letters introducing some of the things that we...
and they never followed up on that.
We have. Just to be clear, Central Bank of Nigeria, with that MOU, took a step to make sure that we are patronized.
Right.
Yes, and this is not just for garment manufacturers or medical supply manufacturers, this is also for the textile companies.
Yes, because I remember the central bank was really big on textiles and reviving that industry.
Yes, because we have over 25 functional textiles and over 35 fully equipped garment factories in the country. So if each and every one of us could produce 4,000 masks a day, I personally would be able to produce 120 masks a month, and then
120,000 masks.
120,000, I'm sorry, a month, and then think about the 35 other factories that can save the lives of nurses and doctors out there.
Well, absolutely, because we're actually seeing improvisations in other parts of the world, such as the US, of 3D printing by sort of inventive people such as yourself. I mean, who are stepping up and making, for instance, valves and turning snorkeling masks into ventilator masks, and these are being downloaded by hospitals around the world and have become a sort of medical lifeline. I mean, clearly it hasn't reached that level of emergency in Nigeria. But do you think there might be demand for what you're doing outside Nigeria? I suppose the problem is how you're going to get it to them.
Yes, I think there is a huge demand around the world right now. As we know, this is a pandemic. And it's probably based on the projections that we've gotten, it's not going to go away anytime soon. As long as these measures are not put in place, we might be stuck in it for months. So I think the Nigerian government, I call on them to look into this matter. They do have people here that have the technical know-how and capacity to produce these items. We have reached out to them. We just want them to listen, and they should look into it. It's imperative that our economy is keeps going. We can't keep importing things and empowering other economies.
Absolutely. No. I think, I mean, that completely undermines what the Buhari government is trying to do. And my suspicion, and I may well be wrong, is that they're simply not aware of what you're able to do.
Now we are here on Arise TV. I hope they are watching.
Well, I certainly hope so too. But I mean, the sort of things that I talked about using 3D printing, because I know people in Abuja who were making, you know, artificial arms and limbs and that sort of thing using 3D printing. Is that something that, you know, companies like yours would sort of get together, given that you have some know-how of sort of medical equipment, and try and encourage them to do things like that? Because soon enough, they're going to need ventilators and respirators and all that sort of thing in Nigeria.
Yes, I think we've already started working on that. We have a technical committee that the association has set up. We've been deliberating, researching, and we have even reached the states of procuring those machines. But of course, government will need to support us on this because they are expensive machines to procure. Oh,
no, absolutely. There's no question about that. But you said you're laying the groundwork for that.
Yes, we have gone very, very far. And I think they should look into contacting us or looking into our situation.
Well, if they don't contact you, I'd suggest you contact them.
We have done that already.
Okay. Aisha Abubakar Achonu, owner of the Fashion Spaces Garment Factory, a company that manufactures surgical masks and gowns and other medical equipment. Thank you very much indeed.
Thank you, sir, for having me.
You're watching the Arise interview. Plenty more still ahead, including the UN Secretary General Antonio Guterres speaks exclusively to Arise News as he rallies the world in a global call to action against the coronavirus pandemic. Stay with us.